We already established that summer 2023 is officially It Girl Summer. Along with that, we are super excited to announce the ultimate group of It Girl Summer.
Over the course of 5 weeks, you'll make new girlfriends with fellow listeners of the pod, get access to exclusive group chats that include both of us, set goals, attend virtual events, and more.
For only $50, you can get access to all of this. That's only $10 a week. Join the ultimate group of It Girl Summer so you can channel your ultimate It Girl energy.
To sign up, click the link in the show notes and follow the steps on the website. Deadline to register is May 31st, so you have until then to sign up. We will kick off the group on June 4th with our first virtual hangout all together.
We really hope you join our community of It Girls so we can all have the best summer and embrace our full forms. Andrea, welcome to the show. We're so happy you're here.
Yeah, thank you for having me.
Yeah, so let's get started by first talking a little bit about why you decided to become a physical therapist and why specialize in pelvic floor therapy.
So I've been practicing as a physical therapist for about 12 years now. I graduated and didn't really actually know what I wanted to do. To be honest with you, I just took the first job that paid me the most because I was a kid with student debt. So I initially started working in geriatrics, and then I moved to more like orthopedic, sports-based injuries. And then once I had my children, so I have two kids. One was born in 2016 and one was born in 2017. Um, I had these two kids back to back, and I started developing all sorts of pelvic floor problems. And as a physical therapist, when you go to school, you don't really learn much about the pelvic floor and women's health in general. It's all pretty much just like orthopedic or neuro. Nothing really is taught about women's bodies or the pelvic floor. So, anyways, was suffering with bladder leakage. I had prolapse. I had postpartum back pain. And I thought I could fix myself, but I really couldn't. And so I needed to seek help. I actually just started taking more courses in pelvic floor therapy and just loved it. It worked for me. I got rid of all my symptoms and I was hooked. So I started treating that population.
That's awesome. I feel like a lot of times, especially with like women, we feel like we kind of have to like suck it up or like, okay, we know that like periods are bad, so you're gonna get cramps, or we know that childbirth obviously is painful and there's a lot of stuff, so like you're just gonna have to deal with it. But I think there's a lot of women that don't know that there are things out there that you can do. For example, like what you do. And I know like personally our mom, like she has like issues with like she has pain still, and we're 22 and 21, but like she has this chronic pain from like when she had kids in her pelvic area, and it just hurts, and like no doctors have really like helped her that much, and so like she would definitely benefit from this, but it's just sad that a lot of us just really don't know the options out there when there are really good options.
Yeah, 100%. I think that's like one of the biggest things that I love to do is I do a lot of workshops where I'll just talk for free for like a gym, like a Pilates studio, businesses. I talk to my local chamber of commerce about pelvic floor physical therapy. So I really love getting out there and just telling women about their bodies and how I can help with these like more intimate problems that no one really talks about. So like a lot of folks that will go have their baby, they go in for about one checkup afterwards. So usually that's about the 6 week mark after your baby's born. And for most of these women, I mean, the doctor's looking them over, making sure their blood pressure is good and if there's stitches and how things are healing. But then that's about it. So after that 6 week mark, a lot of women are just kind of left to figure out a lot of things on their own. And a lot of doctors will recommend pelvic physical therapy, but sometimes they're only recommending it if there's a big problem. Whereas, like, I love to tell people it's really good to at least go to one checkup after you have a baby and to understand and learn about your body and learn about the things that maybe are common, but they're certainly not normal. So, so things like bladder leakage, I know a lot of women, especially older women I treat, have been told that's something that they just should live with, or like that's just what happens after you have a baby. And I especially love working with those older women too and getting them to like reframe their thinking that no, this is something that can be fixed. This is a very treatable thing.
Is there anything else that you frequently hear from women you work with or like women you help that after receiving help from you, they're like, "Oh, I didn't know that was a thing." Like, is there anything else besides like bladder leakage?
Probably the biggest one is pain with intercourse. So um, a lot of these women are kind of told that's maybe the way it is after you have a baby, because there's changes in your bodies and things like that. But I feel like those women get dismissed a lot too at the doctor and told to either take pain medications. Yeah, there's medications that can help with that. When in reality, a lot of women with having pain with intercourse that involves like penetration are usually having a tight pelvic floor from either a trauma or an injury or a childbirth. And it's really fixable with pelvic PT. And they're just told, like, take some Tylenol and drink a glass of wine and good luck, you know? So that's
Yeah.
one of probably the biggest ones that I hear about with women um, who are, they're getting kind of dismissed from their doctors about that.
Hmm. That's so interesting. I'm sure like we've all had experiences where we're just kind of dismissed, like with doctors about issues that are primarily women's issues. The example that comes to my mind is I had an IUD at one point and I asked for numbing cream or something, and she was like, "No, you'll be fine. Just take a couple ibuprofen." So I feel like it's a common story for women to be kind of dismissed by healthcare providers in general. Do you see that a lot, like in your line of work? You mentioned that before.
You know, I unfortunately do. I get a lot of the stories about how, like, I've tried to tell my doctor about this and they
Hmm.
didn't really know, like, what to tell me, or yeah, they just tried to prescribe some pain medication. But yeah, I've heard, you know, unfortunately, a lot of these stories where I'm just kind of laughing to myself right now, thinking of one of my patients, and she told her doctor, you know, she was having pain with penetrative intercourse, and her doctor said, well, maybe you have a really bad partner. So it's
Oh,
like not even like that's totally out of line.
yeah.
And excuse me, but that's, you know, things that a lot of women are kind of told when basically being gaslit for a lot of these issues.
Mhm.
Yeah, that is very frustrating. I feel like it's really important to have like female providers out there who understand, like, obviously you've given birth and like you can understand those issues, and knowing like with your set of skills you know how to fix those things, and so you can be an advocate for these women. And so I think that's really important, because I do think that, and not in all cases, but I think that a lot of things like in healthcare, men have it like easier than women, and women are just really told to like tough it up a lot. And like I know I've been told that, so I do think it's important to have like the representation of female providers who actually understand like what you're going through.
Yeah, definitely. And I tell, like, I had a patient who had a male provider as a OBGYN, and she was just feeling frustrated and not heard. And, you know, you can definitely find a second or third opinion. Like maybe if you
Mhm.
find someone who's female or just more in line with your views, you know, definitely have that right to just, if you're not feel like you're getting, if you feel like you're not getting the answers you want, um, you know, definitely seek out other opinions. It's super important.
Do you have anything that you specifically as a provider or your practice do to help girls feel empowered in healthcare? Like when they walk into your practice, is there anything that would help them feel a little more empowered?
Yeah, I think like for my business, I treat mainly women. I have a couple men that I see for like their low back or their pelvic floor, but it's mainly women. And the biggest thing is, yeah, making sure they're comfortable with me. So I have a phone conversation with every patient before they walk into my clinic, and so I understand kind of like what's their biggest why. Like why are you getting help now? What can I help with? What is do you have like a big goal for the future, for maybe just it's going back to hiking or skiing, or maybe just it's like just playing with your kids without back pain or pelvic pain. And so, really understanding why they're there and helping them understand that this is something that is very treatable and fixable. And I hope that like helps them feel empowered that, my body's not broken. It's not just like that's the way it is. That's definitely not the case. And that goes for women of all ages, whether that be like teens or, older women. Because you can have pelvic floor problems without ever having a child too. So that's a big thing that I want people to understand too. If you have a situation like you're peeing your pants with like gymnastics or dance, or you're having severe abdominal cramping, that's not normal. Don't be dismissed by your doctors and just think, yes, I just have bad periods. No, we need to check for endometriosis. We need to check for other possible conditions that could be contributing to that too. So I try to
I
find good.
love
Yeah, go ahead.
I just love how it seems like you really want to connect with your patients and like empower them to do what they want to do. Cause like I've seen a lot of doctors in my life. I've seen like a lot of really great doctors and healthcare providers, but I've also seen other ones who just seem like they're just like in and out, getting the job done, want to fix the problem that they see and not like the problem that I'm like really feeling, like how it's making me feel and like what I want to get back to, like you were saying. So I think that is really important and it does help you feel more empowered as a patient, especially as a woman, to like feel like your provider really wants to connect with you and see your goals and help you get to those goals instead of just being like, okay, this is your problem, let's fix it and that's it. Like really let's connect and have a good relationship while we work on getting you better.
Yeah. And that's the cool thing about pelvic physical therapy is that we get to spend more time with our patients than the physician ever really can. Even the best doctors, I mean, they're limited to like these, shorter visits, unfortunately. And, I know a lot of really great physicians, and it's sometimes in that insurance based model, it's unfortunately you have to keep the people moving. So, I'm in a great position where all my treatment sessions are an hour long, so I'm always spending at least an hour once a week with my patients. And so I get to know them, and I get to know like, okay, yeah, that's something that maybe you should talk to your doctor about. And I'm always up for a collaborative approach. So I'm always recommending other things like acupuncture, massage therapy, chiropractic care, other modalities that will help the person as a whole. Because sometimes these people have a lot of things going on, and they need a full, well-rounded team rather than just me.
Yeah, it sounds like it's a very holistic approach, and I think that's really important. Especially, I feel like we as women like hold on to a lot of stress and like trauma and stuff in certain areas of our body. And so I think it's really cool that you recommend those other things as well as therapy. And I also like that it's more natural. Like you're not like other providers who are just like, well, you should probably talk to your doctor and like get a prescription for this. It's not about that really.
No, it's not. And like the fact that you just brought up, a lot of women having like stress and trauma. The pelvic floor is a really big place where a lot of that stress and trauma is stored. It has an like what's called an autonomic nervous system component, meaning like sometimes when you're feeling that fight or flight symptom and feel like you need to, you're really stressed, heart racing, you need to get out of the situation kind of thing. The pelvic floor will respond to that. And so in cases of, unfortunately sexual trauma, people have pelvic floor dysfunction just from their nervous systems reacting to that trauma too. So,
We're going to take a quick break to talk about our sponsor, BetterHelp.
It's 2023 and it's time to really prioritize our mental health this year. No matter where you are in life, everyone can benefit from therapy. Whether you need to work through trauma or just need a safe person to talk to, BetterHelp is here for you.
BetterHelp is the world's largest online therapy service. Get matched with a professional licensed therapist in your state who you can trust.
BetterHelp has options to communicate with your therapist via chat, email, or video, and you can message them at any time to get help.
BetterHelp is giving our listeners 10% off if you sign up using the link in our show notes.
If you're struggling with depression, anxiety, relationships, trauma, grief, or just need someone to talk to, try BetterHelp today by clicking the link in our show notes or go to betterhelp.com/RTAFpod to get 10% off today.
That is
That's really
very
fun.
interesting. I'll get like a little personal here. People who listen already know this, but I was sexually assaulted 2 years ago. And after that, I did have some struggles like feeling comfortable like sexually, and even like there was like a lot going on with just like sexual repression with like religion growing up. So there was just a lot of factors. But for a long time after, I had a really hard time like having an orgasm. And so do you ever see like that playing a part into it, like sexual trauma? And can you help with that? Like, is that common?
Unfortunately, sexual trauma is a lot more common than people, are told about. It happens quite frequently. Lots of women will report sexual trauma to me, and as a part of their medical history, and I so appreciate them sharing that piece of information with me, and I'm really sorry to hear that happened to you as well. Like,
Thank you.
it's just, yeah, and just so you know, it happens a lot more than you think. And I think if women reported the true, um, all those instances, like if we were actually able to stack up that number, I think it'd be pretty shocking to a lot of people. So,
Hmm.
um, yeah, and I get, it just kind of depends on the person and what they're comfortable with. For some women, they're not too comfortable with me touching near their pelvic floor to try to assess the muscle. So it's something that we're just like working towards. So maybe I'm working on just getting them to like feel comfortable in their hips and like move their hips around and work on, stretching and mobility there. So it just, yeah, it just kind of depends on the person and like what their experience was. And, but, I feel like very honored to know when people want to feel comfortable sharing that information with me. It's great to be able to kind of really understand what that person went through.
Yeah, I think like obviously it is a really hard thing, but I think like when recovering from something like that, like you go to therapy, but there's not really anything else you can do. And like for me, I like really struggled because I was like, oh my gosh, like I like can't reach that point, and it's really like it's hurting my confidence. Like it was just hard, and I just thought there was like something wrong with me. And so I feel like if women know like the natural options that they have and like can find like a trusted provider like you, and like form a good relationship with them, I think that's really important because I didn't even know about that, and like that could have possibly helped. And so I think it's
Yeah,
cool to spread that so that women know.
yeah. And there's other like body workers out there too. I'm trained in really like diagnosing the muscle problems of the pelvic floor and trying to get people to, yeah, tune in with their bodies and make sure they're able to relax that pelvic floor, but also making sure it works appropriately. But there's people like sexological body workers that can help you tune into like your sexuality. Um, some massage therapists as well. But I can also recommend a book to you. Have you ever read Come As You Are?
I have not.
Okay, you should definitely look at that book, Come As You Are,
Okay.
by Dr. Emily, I think it's Nagoski. Um, it's a fabulous book about like finding your um, inner like self, and like it's a great book for people that feel like they're broken or they can't have an orgasm or they're having trouble with finding that sexual performance aspect. So it's
Okay, that's super helpful. I will check it out.
I'm really interested too. Do you have women that come to you specifically for like sexual issues? Like not necessarily like after sexual assault or rape, but like, hey, like I want to improve my sex life, basically.
Not a ton, I will say. I think that's just something like people aren't really aware of. You know, I look at it more from, yeah, like an anatomy standpoint. It's like, okay, women mainly orgasm with clitoral stimulation, so it's like just kind of giving them information like that and knowing like, okay, what's your anatomy? Where are things located? Um, I don't always get people that just want that information, but I'm more than willing to provide that and make them feel comfortable.
Okay, cool.
But just like
Do you
learning.
have Oh, sorry, go ahead.
Oh no, that's all done.
Um, I was just gonna ask, do you have any tips for women like in advocating for our health and like just in that space in general? Because it can be scary
Intimidating.
or yeah, intimidating. So do you have any tips for how we can like advocate for our own health?
Yeah, I think let's say you're going to go to the doctor about your severe like abdominal cramping you get when you have periods. I think what's helpful is like just writing down all your thoughts too. So I'll tell people, write down everything you want to say to the doctor. Like be very specific on your symptoms and when they occur. Um, and like don't stop asking questions. I think just like, okay, yeah, but why? Or, okay, but if that happens, then what happens next? And just like leading with another question just to get more information. Like, don't settle for an answer if you really don't understand. Ask more questions.
That's great advice. I feel like there's been several doctor's visits I've had and I walk out and I don't remember or am kind of confused about what they told me and like what even happened in the visit. So I think that's great advice, especially when you're going for something specific. I think how you said like documenting like when it happens and what it feels like and trying to give as many details as possible so that the provider can try and figure out exactly what it is. And that way you're not just going to the doctor just to say you went and try and get some help and they don't help you. Like you're actually trying to dig deep and help yourself more.
Yeah, totally. A lot of my patients, they have to write down what we talk about. They're like, wait. And then sometimes if they need me to email it to them, I'm happy to do that too. But just things like exercises or like homework advice, it's just write it down right away so you don't forget.
Yeah, that's super helpful. I know like a few weeks ago I got my first pap smear and I brought Ken's cuz I was like so scared, but before I was having some like I've actually been having like pelvic pain for like 2 months now, so like I'm like trying to get treatment for that and on the diagnosis journey. But actually how you mentioned like endometriosis, they like think that's what it might be. But I had like all of these things like, okay, like the pain has been going on for this long. It feels like this. It's like this intensity throughout the day. And I like wrote it down and I told Kenz, I was like, do not let me forget because I really like once you get there, it can be like intimidating. And even though I have like really great providers and they're female, so like I feel more comfortable with them personally. But it's still just like, okay, there's a lot going on right now and I don't want to forget. So I think that is a really good tip. Just write it down and don't be afraid to ask because it really is like for you and the providers are there for you. So like make sure that you understand it.
Yeah, and doctors, they want to help. That's why they got into medicine. Like they don't want to be
Mm-hmm.
dismissive. It's just unfortunately the way our healthcare system's set up. It's like a numbers game, and they're only really allowed a certain amount of time per visit. So, um, yeah, I mean, yeah. So just try to be organized and know what you want to get out of the visit, and then kind of going along the lines of pap smears too. Sometimes I'll treat women who have gone many many years without a pap smear because they're so scared to have anyone touch down there, or it's always been super painful with like the speculum, the instrument that goes inside them. So um, I treat women sometimes and just work on getting their pelvic floor to relax and let go easier so that exam is not as painful. So I had a patient not long ago. She hadn't had an exam in like 25 years, like a really long time. And we
Wow.
worked on, yeah, some pelvic floor lengthening so she could go get her pap smear.
Wow.
I think that's amazing that cuz like that's a obviously if you go without an exam for 25 years, like that's a very real fear and that's nerve-wracking. And so I think that's amazing that you're able to help women like overcome that and work on it so that it's not as painful. And again, like I just don't think people know about these options because I didn't know about that before you're saying it. So I think that's really amazing that it's not just like, oh, physical therapy because I have an injury and I need to get better. Like there's other ways that you can help them.
Yeah, totally. Yeah, and that's probably one like a lot of people don't know. They just don't get a pap smear. That's like not really an option because you don't want to have cervical cancer, right? So like go
Hmm.
everyone listening, go get your pap smear. But if you're really worried about it and you just haven't been in a really long time, maybe go see a pelvic physical therapist first and tell them what you're worried about, and then we can actually look at your pelvic floor muscles to see like yeah what's happening.
Do you have any like how do I phrase this? Any exercises that women can do at home that would help just kind of like relax the pelvic muscles? Like, does yoga help? Does Pilates? Like, is there anything in particular?
Yeah. So the biggest thing is to do diaphragm breathing. So diaphragm breathing is a really good way to relax the pelvic floor because it helps calm the nervous system when you breathe using your diaphragm, which is like right here, right in your under your rib cage. Okay.
Okay.
So I can teach you real quickly how to do it. So if you put your hands on your ribs and you take a nice inhale breath and you try to inhale and allow your ribs to move into your hands. So don't breathe in through your chest like this. Try to breathe in through your rib cage to the sides like that. Okay?
Okay.
That's
So you
hard.
take a breath in, try to fill your lungs with air and feel the ribs expand to the sides, and then exhale.
Ooh, that is hard.
Because
And
that's
it
not
might
how
be
we normally
challenging at
breathe.
first, especially if you're kind of like an anxious person and you're always like fight or flight. You might just not have you might have difficulty doing this at first. So usually just practice it lying on your back at home, um, putting your hands on your ribs and trying to breathe into your lower rib cage. Again, that helps relax the pelvic floor because the diaphragm and the pelvic floor kind of work like this with the breath. So when you
Okay.
inhale, they both stretch, and when you exhale, they both lift when you breathe.
Okay.
So definitely, that's the first step is to try some diaphragm breathing.
Awesome. That's like super easy to just like if you said like start with lying on your back, like when you get in bed at night, just like do some breathing. And that's like a really simple thing to do. I'll definitely be incorporating that.
Yeah, yeah, definitely. And the biggest thing too is not to do, you don't really want to do Kegels for something that you're having a painful condition for and a lot of pelvic floor tightness. That's really like the opposite of what you want to be doing. You really want to be relaxing your pelvic floor and not trying to like over strengthen it when you're trying to calm it down if you've had a lot of pain and tension in there too.
Okay. That is good to know because I feel like that's very common. Like, okay, go do your Kegels, like strengthen your muscles down there. But that's nice to know that if you're having pain, don't do that.
Yeah, don't do, it's really not the best for you. So, um, yeah.
Okay. Well, I think that leaves us, the listeners, with something to do that we can easily like start to strengthen our pelvic floor. Do you have anything else that you want to add that you might find that listeners might find helpful, or do you have any like resources or how they can find you, anything like that?
Yeah. So I'm in Arvada, Colorado. My physical therapy practice is called Movement Physio and Wellness. So we're a pelvic physical therapy clinic in Arvada. Um, you can book a phone consultation with me online. You can go to my website. movementphysioco.com. And you're more than welcome to book a phone call with me. It's free, so you can just talk to me about what's going on, and I'll let you know if pelvic PT is probably a good step for you. But really finding a local person in your area if you can. If you live in more of a rural area, I do virtual visits as well. So you can seek out a physical therapist for a virtual visit. Um, and, I love treating people in person, but virtual works great too for a lot of folks, especially if you're not local to a therapist. Another place you can find a physical therapist, there's a few websites. Pelvicrehab.com is a website. You can type in your city and see what comes up for pelvic physical therapists too.
Okay. It's nice to know you do virtual visits because there are a lot of people who don't really live close to a major city or don't have access, so that's really nice to know.
Yeah. I see a couple virtual clients right now. Yeah, it's a great way. There's a lot we can do with movement that you don't always just need hands-on work. But I give a lot of great advice with those sessions too.
Awesome. Well, we will definitely put your website and everything in our show notes so that our listeners can connect with you. Do you have anything else you want to add before we end?
Um, no, I mean, thanks for having me on, gals. Like, just great to talk. I love talking about this stuff. So, I think the biggest thing is just advocating for yourself too, and realizing a lot of these symptoms that maybe we've told ourselves were normal, they're really not normal. So, seeking help for things like bladder leakage, pelvic pain, um, all those things are really important.
Awesome. Well, I think this will be really helpful to our listeners, and thank you for coming on the show.